So Bob, I remember you have right shoulder reverse replacement, right?
Yes. 6 years ago, I had a very successful right shoulder, reverse shoulder replacement. And what that is, they switch the way it goes. Well, anyhow, 2 years ago, it was detected on an x-ray that I was starting to get some bone loss. So my doctor, my orthopedic surgeon, who's very good, he did nothing wrong on the original the original replacement. It's just somewhere along the line I picked up a bacterial infection that went to the bone. So he was seeing me every 6 months, and he was seeing the progression of the bone loss. And eventually, let's say November.
How come the two screw floating around?
Well, they weren't floating around, but I was going to say let's say November 8th, I was picking up something off of the car seat of my car, and it only weighed like 4 pounds, and I moved my arm a certain way, and because the bone loss was around where the screws are for the ball, I dislodged 2 of the screws. There are 4 screws. There's 2 that do right, left, and 2 that do up, down. And there's an anchoring screw, which is the middle screw, which is the important one that holds it in place. And that I bent so that the ball in the socket was 16 degrees off center. So on November 11th, I had the surgery, which is called a reverse shoulder revision. And they have to take the original prosthesis out, and then they scrape. It's a much larger incision than the first one was because they have to do a lot of work in there. They have to scrape all of the bacterial infection that is on the bone that they can see, and then they put the new prosthesis in, and I can't move my arm. They put me in a sling that's stationary. And because of the infection and still having bacterial infection.
Let me interrupt you.
Sure.
If we diagnose any infection in any part of the body, the white blood cell will go up. Some people don't have fever. Like me, I never have high fever, even I have infection. But the white blood cell should go up. But I was looking at your blood work, the white blood cells never went up. Does it go up if they said it's infection? And I think if it's not going up, if the other white blood cell, like other cells like eosinophil cells, and it went up, that means you have some kind of inflammation there. So let me ask you, is the white blood cells neutrophil cell going up?
I wouldn't know.
So
they took blood work every other day to make sure that the IVs that I was getting was not causing a problem with my kidneys. So I was having blood work, and I guess the levels were fine, or they would have said something to me, or they would have treated me with something else.
See, the thing is, you had the foot infection prior to that.
Yes, about a month before that. So
by doing the surgery, you're gonna increase the chances to have prolonged infection. And usually, like when I had a C-section with my second child, they will preventatively give me the antibiotics. And so in this situation, you already had a foot infection, and they're gonna open up your right shoulder and put a new prosthesis and new screw there. So I think if it's an infection, then there should be increased white blood cells. So I think if you don't have fever, you don't have white blood cell neutrophil going up, very likely you have inflammation, and that can cause bone loss. So to prevent the future bone loss, the most important thing I suggest to reduce the inflammation. And to control or optimize the inflammation, you need to drink more water, control the blood sugar, and avoid carbs. And the other very important thing to keep the right shoulder in a good condition is the muscle and the ligaments in good condition. If the muscle get very tight, and then the joint is artificial, but the muscle is still yours and ligaments, and then you try to, pull the weight or do something, then you can pull the muscle, right?
Well, right now I'm on non-weight bearing. That means I can't pick up large amounts of weight, and I can't use my hand to push me up, or it's non-weight bearing. Now I do see my doctor, surgeon, in about another month, because I see him now every 6 weeks. And I'm sure, because I am doing much better, he's going to start to put me on some PT that will increase the activity that I do and increase the strength of the muscles that are working my prosthesis.
Right now, can you sleep on the right side?
Well, I haven't bothered to try.
Okay. Do you still have pain?
Well, not much. Right now it's probably between a 2 and a 3 on a scale of 1 to 10. Now, if I do certain things, I will find it increased. It's just, right now, to tell you how my pain level is, it's maybe a 2, 2.5.
Okay.
But if I do a lot of activities and maybe a few things that I'm not supposed to do, it will go up to maybe a 5.
Yes.
Which is, 5 for me is painful.
So I think to control the inflammation is the key to keep the joint in a good condition without too much pain. Inflammation is the process to protect us. So if there is a bacteria invading, or there is allergic reaction, or there is wear and tear, the old tissue, the cells, the lymph cells go in there, try to clean up the old tissue or bacteria. But if the inflammation are persistent because of the high sugar, high salt diet, or poor circulation, so that's why, we use acupuncture to make the muscle in good condition so that it won't be too tight, and to improve the circulation so that we can clear up all the bacteria and dead tissue. And also we bring the nutrients to the shoulder and your foot to regenerate the tissue.
Yeah, I asked my surgeon, my orthopedic surgeon, if he says that these started to show up. He was seeing me every year. So 2 years ago, as I stated, he saw the start of bone loss. And I told him that I can't remember running a temperature. I can't remember, not feeling well, that I would know when I caught this bacterial in my body that went to the shoulder replacement. And he just said that's not uncommon. If it would have been another infection, that I would have ran a temperature of 100, 101 or so, I would have went to see a doctor right away, because I am very protective of multiple joints that I've had replaced. But I never felt, there was no warning at all. I never felt anything.
There's no redness, there's no swelling, there's no temperature. So I doubted there is infection. I just think it's inflammation.
Well, they treated me for 6 weeks, and the doctor said he scraped a certain amount of things off the bone when they had replaced the prosthesis, and it's a larger prosthesis, because some of the bone that holds the cup in place had deteriorated, so they had to use a larger shaft to go into my shoulder. So I'm confident that what he did was the right thing. People, orthopedic surgeons will send their patient to him because they can't perform the surgery that he just did on me.
Thank you.
Thank you.